Sí, sí, yeah.
I know.
Oh, yeah, let's sit, no? But we don't have to be standing, no? It's not recorded. It's, meaning it's only recorded, but not.
Only the audio.
No, it's audio. Venga.
I know there's more concern among the more vulnerable, older, and underlying hard, long issues.
Yes.
So, I mean, what can we tell them if they're now hopefully at home? What can we tell the most vulnerable right now? What's
Right. Even for the most vulnerable people, still the incidence of complications with the disease is minimal. So what we're looking at is this is a virus that affects, and it will eventually affect a lot of people within the population. Maybe not this year, maybe within the next decade. But again, what we're seeing is most of the people that get infected, they have no problems with it. Only those who have problems, which is a minimal proportion, we're seeing that among the people that get more problems, there's more prevalence, there's more frequency, if you want to call it like that, of patients that had other problems. But that doesn't mean that if you have other problems and if you catch this disease, you're going to be in trouble.
But you should be extra careful, no?
Right. Well, you should be extra careful in the sense of two things. If, obviously, the protection measures that we're asking is for all the population, not just for the more vulnerable ones. It's for everybody. So everybody should be protected and trying to not spread the disease as much as possible. So we're avoiding gatherings of people. We're avoiding contact as much as we can with elements. If we touch a surface, we're asking people to wash their hands, to clean them, to maintain the hygienic measures that I'm sure everybody already had heard. But if you happen to be sick, then you need to at least seek some medical advice. And that's what we get. For example, in Baptist Health, we offer care on demand. And again, care on demand. And we're insisting on using it because it's an option to reach your health professional, to ask several questions. This is what I have. This is what I feel. What should I do? And you will be directed appropriately. So if you happen to have any comorbid diseases, so any other problems, and you happen to be infected, or you're concerned that you could have been infected, contact immediately our centers. Don't go to the emergency department, because then we might not be able to help you there. We might be attending other people, and then you're actually exposing yourself even more when you go to an emergency department or a hospital, because there are other sick people there. So we're asking you, get your health professional on the phone. Go on Care on Demand. Find out exactly what to do. That way, we're essentially monitoring those people that are vulnerable a little bit more.
From what I've read, shortness of breath symptom seems to be maybe the one indicator that people should look out for that it could be more serious. Is that? And can you explain why that is?
And that is also correct. So this virus seems to be represented by fever, also by general malaise, and some cough. For now, those are essentially very common to other diseases and portray no more problems. However, even if you get any other virus and you start having shortness of breath, that should be an indicator that you need to seek medical attention. In this case, we know that for a fact. So that means that if you happen to have the fever, the general malaise, the cough, and also you're presented with difficulty breathing, this is a good moment to go ahead and contact your health professional and find out what the next step will be. And the next step could be, let's go to this particular place, get an x-ray, let's go to this place, let's do this test, or...
And just for people to understand, and I know this maybe sounds like a silly question, shortness of breath means generally, is this you get exhausted easily, or is it just sitting and you sort of gasp for air? I don't know if your experience.
It is an outstanding question, and shortness of breath is very difficult to define. So starting with, because people can label that with many aspects. What we define as shortness of breath is the difficulty breathing, the lack of air when you do normal things. Now, if you're going 4 floors of stairs and you feel lack of air, that might not be shortness of breath. It just might be that you're short of shape. Let's put it that way. So it all depends. Now, however, if you're obviously accustomed to go from your living room to your kitchen to get a bottle of water or a glass of water, and then suddenly doing that, you feel and you experience shortness of breath, which you've never had before, that is an indicator of shortness of breath, as an example. And many other aspects. Again, it's just the lack of air, that you feel it, that it wasn't there before, nothing that you perceived normally. And this is very questionable or very important for people who have chronic lung diseases, because people with chronic lung diseases or chronic heart problems, they might actually have shortness of breath frequently as a baseline. So it's very difficult for them to identify if this is different than what it is normally. And that's why sometimes those people are the ones, as we mentioned before, that they might need some medical attention to contact their health professional.
That's a great. I mean, I think I'm going to just do one article on shortness. What exactly is that barrier? That's great. Anything else that since we last spoke 2 weeks ago, whatever it was? Seems like it was 2 weeks ago. It's probably last week.
Yeah, I don't even know. I think it was 2 weeks. Nonetheless.
Anything new? I mean, in terms of your experience here, I don't know. We're still in the early stages. So
I don't know. I don't know what stage we are right now, because I think we're implementing a lot of measures earlier than other places and other countries, to be quite honest. So I think Europe was caught by surprise, in the sense like they didn't expect this huge transfer from China coming to Europe, and they're kind of reacting to the issues. And I think, honestly, we're doing slightly better in that sense. We're not out of the hook. And definitely, we still can have significant problems. And the worst thing is that we don't know what those problems will be, because we got to stay tight and prepare for everything. But I honestly think that the main message for the population is, again, the importance of recognizing when you're sick versus when you're not sick. And preventing the spread of the disease is not about getting the test. It's about preventing the spread. If you feel any symptoms, such as the cough, such as fever, such as the general malaise, such as the tickling on your back of the throat, it might be a good moment now to start contacting people and not to spreading this to other people, as opposed to just being concerned about, should I get the test? Should I get the test? Well, again, most people with the disease are going to behave very mildly. And when we say very mildly, means 2, 3, 4 days with some minimal symptoms, and taking a couple of medications over the counter and getting some fluids and resting at home, and that will be over. And again, that's for probably over 90% of the actual population that really get infected. So I think it's very important not to be alarmed, but just to be cautious. And I think it's a strong message that we need to transmit to people.
One quick last question. I was reading something about one of the patients who was interviewed, asthma. Is that an underlying health issue that might be a problem? And asthma, it can be common in younger people.
Yes, and asthma is an underlying issue, because asthma also can give you shortness of breath.
Right.
And again, that goes into what is shortness of breath, and if this shortness of breath related to this infection, or is it related to my disease? And again, that's why my recommendation is, if you have any problems and if you feel the symptoms, contact your healthcare professional. Don't go, just pick up the phone, call, get on Care on Demand, ask them, get some more information. That's it.